India is in the grips of the world's worst COVID outbreak as essential medical supplies like oxygen are running out. Countries from around the world sending desperately needed aid, but it has been too late for many.
India's leader had declared the pandemic defeated. Clearly
Right.
it's not. CNN's senior international correspondent Sam Kiley, he's been on the ground in New Delhi in the midst of it. And Sam, it seems a consistent message you're finding there is just how overwhelming it is for healthcare workers.
Yeah, I have to say the public healthcare system has been so overwhelmed that you find me on the outskirts of Delhi at a makeshift camp being run by Hemkunt, which is a Sikh charity. They have been able to procure, or had been able to find, a few of these, the essential supplies of oxygen. This is now empty though. There are only 2 patients left because there's only oxygen left here. This whole area had been full. All of these canisters are empty. Now this is the scene in the makeshift end of the story. But take a look at what it's like in a really significantly big and well-equipped hospital.
Tears for a much-loved colleague, Dr. R.K. Hintani, killed by COVID-19 in the same hospital where he'd spent a year treating other victims of the coronavirus. Grief and the inevitable silent question, who's next? He died here in this intensive care unit because the Batra hospital where he worked ran out of the most basic necessity, oxygen. He was not alone. The medical director of the hospital, S.C.L. Gupta, gave the mid-afternoon casualty figures in this war against a virus.
8 patients died today, died just now. And 5 patients, they are under resuscitation. May or may not survive. Just because in the capital city of Delhi, and because of want of oxygen, which is the lifeline.
He knew the chances of reviving the 5 were slim.
When you heard this morning that you had just a few hours of oxygen and then 8 patients die, what does that do to you, to the soul of a doctor?
I cannot explain it in my feet. We are dying inside. We are the saviors of our lives. And we cannot express our feelings. I cannot express my feelings. How I'm feeling inside.
Is it destroying you?
Yes.
How long have you been a doctor?
But
How long have you been a doctor?
45 years.
Must be soul destroying. I can't imagine what it must be like for you. I'm sorry.
I'm sorry, sir.
Over the next hour, 4 of the 5 resuscitation patients died.
In the space of about 2 hours, when the oxygen ran out, 12 people died in this hospital, which in every other respect is a first world facility. They simply asphyxiated.
The hospital copes by advising patients to source their own supplies of oxygen to cover its erratic supplies. Local and international efforts to get enough of the gas into India's capital are still failing. India's central and national governments have been unable to explain the oxygen shortages, and as the numbers of people infected with COVID-19 soar in India, along with the daily death toll, the Batra hospital, like many others, will admit no more patients. There's no point.
We will not take more admissions because we don't want people to die in front of us. So they can go to other hospitals where the oxygens are available.
Dr. Kishore Chawla runs a Hindu temple charity. He pulled through COVID before the oxygen started to run out.
From housekeeping, these and even the nursing staff, the supervisors, all are working very hard.
Fair enough. But the Indian government's failure to ensure basic supplies to hospitals in the face of a long-term pandemic is simply not going to wash.
Sam, wow. I mean, you listen to that doctor saying we're dying inside, and then as you just brought up at the end of the piece, the failure of the Indian government on so many levels, right? And now you have the Indian Supreme Court ordering the government to take more action to try to curb the spread and issuing them with a really stern warning as well.
Yeah, an extraordinary political intervention, essentially, by India's Supreme Court. They do have an interventionist court here, has to be said, but on this occasion, it is almost struck preemptively or partly to prevent any further attempt at what they are basically suggesting is government attempts to censor the media, to censor social media in particular, during shout-outs for oxygen, censoring government officials who are very, very, very reluctant indeed to talk publicly about what's going on, but also to require, under the Indian constitution, the government to up its game, frankly, to simply get involved and get the oxygen out into the communities that so needed. Poppy, Jim?
Sam, this variant that has made such a difference in India, a negative difference, has shown up in other countries, including here in the U.S., but also in Israel. But Israel has seen data that shows that the current vaccines do have a lot of efficacy against this. I just wonder where India's vaccination effort stands in the midst of this crisis.
They've got a vaccination program that has only managed to vaccinate just over 2% of the population. At the moment, they were supposed to sort of reinvigorate it on the 1st of May, but a number of states have simply said we can't do it because we don't have enough vaccines. So in Maharashtra state, for example, they had planned, before the increased effort was made, to vaccinate 800,000 a day. They had to reduce that to 200,000 due to lack of vaccines. There are donations coming from around the world. Even Pfizer has promised some 70 million jabs. But at the moment, it's still fairly much at its infancy. Jim?
Yeah, it's some help from the Biden administration as well, but I know India wants more. Sam Kiley in New Delhi, thanks very much.